And all right, well, let's go ahead and get started. We have a great session on tap for you all today. We're so excited to have experts joining us from the Department of Public Health, experts from CSDE. So we will go ahead and get rolling. So I am here with my colleagues, Jaren and Ian from EdAdvance. They are managing all back-end Zoom logistics for us. And my name is Caroline Calhoun. I am a professional learning specialist here at EdAdvance in the northwest corner of the state. It's a foggy, humid morning here in Litchfield, and hard to believe we're already into October. I'm also joined by my colleague Kari Sullivan Custer from CSDE, who we will be hearing from in a little bit about some exciting national initiatives taking place to orient you around our topic of health today. And we are also joined by Chloe-Ann Bobrowski and Kristen Kondash from Learn and Kristen Soto from DPH. So we have a whole panel for you today with lots of excellent information. So let's go ahead and go to the next slide, and we'll just do some quick share outs. If folks don't mind popping into the chat, introducing yourself, sharing what your role is, and maybe just something that you're hoping to learn about student wellness as it relates to attendance during today's session. And as always, a big shout out to our CSDE partners. We wouldn't be able to do this series without them. Jay Brown isn't able to be here today, but from the Bureau of Special Education, we are always appreciative of his support. To our EdAdvance team, to our presenters, and of course to all of you, the participants who are making time to join us for this community of practice. So I'll let you all keep the chat rolling, introduce yourselves, note something you'd like to learn, and let's go to our next slide. As always, we want to draw your attention to some things that are really relevant from the Superintendent's Digest. If you're not signed up for this distribution list, we encourage you to do so. There's great information in there, but a new item we wanted to draw to your attention is that the Seal of Biliteracy dashboard has now become public. It used to only be through EdSite Secure that folks could access this information, but now there is a public version of this. It's linked for you, and in case you are not already aware, the Seal of Biliteracy recognizes our high school graduates who have really attained proficiency in English and another language, which is just such an amazing accomplishment. And the interactive dashboard shows us the counts and percentages of those graduates who've passed a test, not only in English, but in a language other than English. So it demonstrates their proficiency. And all of this information was previously in EdSite Secure, now it's public. So there's a link there for you about the Seal of Biliteracy guidelines. We do encourage schools to take advantage of this offering. It is such a wonderful thing to be able to acknowledge our multilingual learner students who have made this accomplishment, and it really is a wonderful program, so we encourage you to check that out. In our next slide, I have a little information for you about a less enjoyable topic, but equally important. The Governor and Commissioner Russell Tucker and Commissioner Ronell Higgins have organized a symposium all about targeted violence and terrorism prevention. So on October 17th, the symposium is taking place at the Legislative Office Building, the LOB. There is more information there for you, and to sign up, there's a registration code provided for you, and leadership is really encouraging folks to join this to learn more about this important topic. Next slide, please. So coming up this Thursday, we have a webinar through Education Week, and it is featuring not only Dr. Robert Balfans out of Johns Hopkins, but also Kari Sullivan Custer from CSDE. So they are going to be sharing information about how to boost attendance, what are schools doing to cut chronic absenteeism. It's free, it's an hour, so we really encourage folks to join. The registration link is there for you with more information. So if you're free from 2 to 3 o'clock this Thursday, hop on so you can hear from Kari and Dr. Balfans. Next slide, please. I mentioned the last time we were together that the RESC Alliance is offering a new series of PD around how to support districts with all things MTSS. So there are a host of offerings throughout the year. Again, our link is there so that you can check them out, what the different sessions are, and register. We did just want to draw your attention to the fact that the November 3rd session, which is virtual, which will hopefully make it easier for folks to attend, that one is all about attendance and MTSS. So I'll be presenting on that alongside colleagues from both CES and Learn. So we're excited to share that information with you during that session on November 3rd. Next slide, please, Jaren. So the last little snippet I wanted to share with you all is many of you are familiar with the Marshall Memo. This is K-12 information curated really nationally from all sorts of publications by Kim Marshall, a wonderful educator. And he does a great job just giving us a snapshot in a really easy to follow format that is fast so that folks who are busy, as all educators of course are, can get their heads wrapped around all of the information constantly coming our way. So one item from that Marshall Memo that came out late in September that I wanted to highlight for you is from a publication called Evidence Snacks, which is published by an educator named Peps McCrae, and he is an award-winning author and educator and professional development specialist in the UK. And he really noted that one of the most powerful ways for us to think about teaching is that it is as this orchestration of attention. How do we get our kids, once we accomplish getting them in their seats in school, how do we hold and keep their attention in a world of ever decreasing attention spans? And I love this quote. He says that attention is the ultimate currency of the classroom. And that really resonated with me when I think about how I was able to hold the attention of 5th and 6th graders during my time in the classroom. And he really suggests just some very concise things about we need to minimize distractions for our kiddos. We need to be cueing them frequently, whether that's visual cues, spotlighting information, whether it's verbal cues, and then making attention visible. So that's when you're doing things like students are working together, they're dialoguing, they're writing. You can see that they are attending to the task at hand. And then it's really important to build those habits of attention in our classroom with our students so that once we get them to school, we are keeping them engaged and learning. So I just thought that was a really helpful note to share. I encourage you to check out Peps. He seems like a really fascinating fellow, lots of great information. And as you can tell from the title of his publication, Evidence Snacks, he tries to make everything really concise and easily attainable for folks who are busy and just need bite-sized information. Let's go to our next slide, please. So as a reminder, as always, our LEAP Home Visiting Hub is offering our 101 trainers for home visitors, and the next training is tomorrow. So if you are interested, it's free for everybody. You do not have to be a LEAP funded district. You are more than welcome to sign up, and you will receive some wonderful PD with Nushette Black-Burke and our amazing team of CREC facilitators and coaches. Lastly, I just have a slide for you of some resources that Kari and I always want to make sure you have access to at your fingertips. So we'll leave those there for you. And I am going to pass it next to Kari, who's going to share some information on the next slide about All In for Attendance.
Good morning, everyone. Before I talk about the next slide, I just wanted to welcome you. I hope you're all having a strong start to the new school year. We're hearing positive trends in attendance so far, and we hope that is working for you and that it continues all year long. Before we begin, I just want to say we love hearing from you. Talk Tuesday is about connecting, learning, and sharing. Please feel free to ask questions, share your stories, or add thoughts in the chat. That's what makes these sessions so valuable. Today, we're focusing on an important piece of the whole attendance picture, student health. Students learn best when they're healthy, physically, mentally, and emotionally. Health and attendance go hand in hand. Many absences begin with manageable health issues, colds, asthma, anxiety, or other concerns. That's why school nurses, school-based health centers, and pediatricians play such a key role in keeping students well and in school. When schools and families communicate early and often with trust and through strong relationships, we can prevent small issues from turning into attendance problems. Sometimes a child wakes up with a tummy ache or a headache, not from illness, but nerves or worry about the day ahead. Remember butterflies in your tummy? Often the best thing is to help them to go to school and work through those feelings. It builds confidence and resilience. If we let those anxious absences become routine, they can snowball into chronic absence later on. This is just common sense, not clinical advice, but we see the impact every day. So the all-in-all attendance brief here was released last spring in Washington, D.C. with Kaiser Permanente and Johns Hopkins University and our buddies at Attendance Works, our good friends at Attendance Works. I happened to be there at this workshop, and I thought it was just a fantastic approach to addressing attendance. When education and public health work together, as CSDE and DPH are doing now, we see real improvements in students' well-being and attendance. With that, I'm delighted to introduce our speakers from the State Department of Public Health, my education manager and former school nurse supervisor, Colin Grabowski, and a representative from Learn, who will all share what these partnerships look like in action. So I'm going to give it back to you, Caroline.
Thank you so much, Kari. So I hope everyone checks out that link there about All In for Attendance. It really is an amazing initiative, as Kari mentioned, leveraging the partnership that is so critical between education organizations and folks working on attendance, as well as people working in the health field. So I am going to introduce to you Kristen Soto. She is joining us from the Department of Public Health here in Connecticut. She is the Respiratory Viral Disease Surveillance Coordinator. I love that title. And she is an expert in this area. She's been with DPH for the past 17 years. She has her master's in public health from Yale School of Public Health, and prior roles have included working on foodborne disease outbreak investigations, modernizing hospital syndromic surveillance, and all sorts of EMS data systems. So Kristen is really coming to us with a wealth of information, and we are excited to hear from you now. So thank you so much for being here, and we will turn it over to you.
Great. Thank you so much, Caroline. And before I dive in, I just wanted to also introduce our state epidemiologist and director of infectious diseases, Lynn Sosa, that's on the call to see if she wanted to say hello, as I know many of you are quite familiar from her previous engagements during the pandemic, coming to speak to this audience.
Yes. Hi, everybody. And thanks for having us. It is the beginning of everybody's favorite time of year, which includes, unfortunately, viral respiratory diseases, and making sure that everybody is healthy, both students and staff are healthy at school, is key to making sure that everybody can be in school. So I'm really happy to provide this update to everybody today. So Kristen, take it away.
Great. Thank you. Could you please advance the slide deck? One more slide, please. And one more. So I know that I've prepared formal objectives for this, but basically the crux of what I want to do today is make sure that you as educators have an idea of how we do surveillance here in Connecticut and what resources are available to you year-round, and especially during the upcoming respiratory viral disease season, which we typically consider to be October through May. We know that these diseases can really have a big impact on your school setting, with children being absent, trying to evaluate if children should be in school or not in school, just understanding what's going on in the community. So we really want to make sure that as we move forward throughout this season, that you know what resources are available to you and what tools are available in your toolkit to respond to these respiratory viral diseases when they inevitably happen. So one source of information that I always love to highlight is the CDC's data summary. They have what they call their respiratory illness data channel. And what I love about this website is that it really gives interpretations of data at the national, the state, and the county level. So that if somebody is not really familiar with epidemiology, which we don't expect every person out there to be, it really gives that plain English interpretation of what we're seeing in the community in terms of overall respiratory activity. It breaks it down by our three big diseases, which are COVID-19, influenza, and respiratory syncytial virus, or RSV, and provides context about if we're expecting these diseases to be increasing, plateauing, or decreasing. So as I mentioned, in addition to the national picture, it does have this community snapshot functionality where you can zoom in on Connecticut as a state or your specific county. And again, just have a sense of what is going on. The first indicator, as shown on the left, is sort of overall activity for respiratory illnesses. So in general, how many people are showing up in EDs and urgent care centers with things like cough or sore throat or fever as sort of a general sense of how many germs might be out there overall. Additionally, for each of the three diseases, we look at the specific diagnoses of people being seen in emergency departments. And then a newer technology that we've started to look at is wastewater. And wastewater is basically exactly what it sounds like, where we are testing sewage from select locations here in Connecticut and looking at fecal indicators of the viruses that people are shedding. And so again, this is a relatively new technology, but a great way of seeing what's going on in the community without requiring people to get diagnostic testing or seek medical care. And again, is just sort of one of those new tools in our toolkits to understand what is going on with these diseases. So here in Connecticut, in terms of traditional surveillance, we typically focus on our reportable disease surveillance. And reportable disease surveillance is really reliant on information that we get from our clinical and hospital laboratories around the state. So when people show up and they have a test, if they have a positive result, that can get reported to us. It is also dependent on provider reporting. And oftentimes when we talk about providers, we're talking about clinicians or people working in a hospital setting. But schools are also considered providers, and we also get really valuable information from our school nurses and people on the ground. So for all three of our conditions, they're really in alignment at this point, where we get positive lab results, we get hospitalizations reported, and then we get deaths reported to us. And then in addition, we do have things reportable such as outbreaks or unusual sequelae of these diseases. So things like pediatric neurological complications, which were an emergent issue that we started to look at more closely last year, things like highly pathogenic avian influenza or H5N1 and other novel strains of flu, or really anything that's of concern to you at the school level. We'd always rather get a phone call and determine that something is nothing and that no further action is needed than be caught unaware and miss a chance to act early. And I remember during the early days of the pandemic, you guys were reporting individual cases of respiratory illness. So you were counting staff and students that had COVID and reporting them into a database. Thankfully, those days are behind us, and that is not something we are doing anymore. I know that nobody enjoyed that process. And while it was very important to know what was going on, it was also a huge challenge. However, just because that system is gone, we are still working very closely with our schools, as I mentioned before. The primary way in which we're doing so is by hearing about confirmed or suspected outbreaks in a school setting. These are notifiable by phone to both the Department of Public Health at the state, as well as the local health department where the school is located. And these outbreaks should be reported for all causes. So this could be, in our case, COVID-19, influenza, or RSV specifically. It could be an unusual increase in respiratory illnesses, even if you don't have a diagnosis. Oftentimes we get asked, what is an outbreak? Is it 5 cases? Is it 10 cases? Is it a certain percentage? And we feel that you really know your school setting the best. You know what is like normal and what is unusual. And so we really rely on you to tell us anything that you feel is weird and above your baseline levels and report that to us. And again, when in doubt, it's always better to call and discuss the situation and possible steps that can be taken to reduce illness, rather than missing those opportunities to act early. So we're always happy to talk to you. And if it turns out to be nothing, or you just have general questions, that's a great opportunity to catch up and connect. And again, make sure that everybody is on the same page in this partnership. Next slide, please. So as I mentioned, there are several things we look at when we look at respiratory illnesses. We already talked about laboratory testing. We look at people who are hospitalized, seeking care in EDs, and mortality. We look at wastewater for all three conditions, which is new for this season. Previously, we only had data for COVID-19. And so again, when we look at these systems, it can be very complex integrating data from all of these different sources. So again, we have information that is available to you about generally what's going on, but then also have dashboards available where if you're interested, you can definitely take a deeper dive and look at all of these information sources separately. Next slide, please. One thing that I did want to point out to you, for those of you that might frequent our state websites, we did recently have an overhaul to our state website. So as you're looking at it and trying to navigate, some things might look a little bit different, but should overall be the same. One thing that's new in the last year that we're really excited about is a landing page for our infectious diseases branch. This web page is really a one-stop page where you're able to access any resources that might be needed about any infectious disease that we work on here at the State Health Department. So it has general information. It shows our hot topics and frequently visited pages, which respiratory viral diseases are right there. Everybody loves our respiratory viral disease dashboard and is something that's frequently visited. It has links to our forms, reporting requirements, statistics, our newsletters. It has all of the links to our different programs and their various fact sheets. And then it also has contact information for all of the programs. So this would be a really great page for you to bookmark, if nothing else, as a way to be able to reach out to us here at DPH in case any questions come up in the future, either about respiratory viral diseases specifically, or really any infectious disease matter that you might have questions about. So if you click on our respiratory viral disease surveillance tab or navigate to this page directly, it will give you information about respiratory viral disease surveillance as a whole in Connecticut. So the first link will highlight our viral respiratory disease surveillance dashboard, which I'll go into in more detail in a few minutes. Typically, this shows data for the current season. We're in the process of making adjustments to launch for this official 2025-26 season, so that link should be updating shortly, but in the meantime, the data are still there and current. We show data from previous seasons for comparison purposes. And then we also provide links to some of our favorite resources, both internally as well as on the CDC webpage, and communication materials that might be of use. And again, really just want to make this a convenient place for you to find all of the respiratory viral disease resources that you need in a single location. So one of the things that we're really excited for this 2025-26 season is that we will be making some improvements to this dashboard to make it more user-friendly. One of the lessons learned during the pandemic and in the aftermath as we work on integrated disease surveillance for these three circulating conditions is that although we think of our respiratory viral disease season as being from October to May, the germs don't really care what we define as the season, and there has been year-round activity, especially for COVID, which typically has a late summer peak. We wanted to make sure that we are accurately depicting what is going on with these conditions and that we have accurate data as to sort of understanding the burden of these conditions in Connecticut. So as we move forward, not only will we be updating this dashboard year-round as we've been doing for the past season, but we'll be making some other changes to better utilize the resources that are available to us, as well as, again, really focus on that year-round burden of disease as opposed to just specific points of the year. So if you look at nothing else on our respiratory dashboard, this landing page will be pretty much the same going forward. It is going to continue to show our syndromic surveillance data, which is a representative of weekly emergency department visits. We look at what people are being discharged with for all of these conditions statewide, and it gives us this nice peek over time to show us a good summary of what is going on with these 3 diseases overall. We'll also continue to show the image that depicts our hospitalizations by week for each of these 3 conditions, which again is a good indicator of more severe illness and understanding both the circulation of these viruses as well as the burden on the healthcare system. Next slide, please. So for the next 3 tabs on the left-hand navigation bar, influenza, respiratory syncytial virus, and COVID-19, they are formatted pretty similarly, so I will spare you clicking through all of them. But for each of the 3 diseases, we show data by case data, which is our laboratory testing data. We show our hospitalizations, and we show our deaths. And then for both hospitalizations as well as deaths, we show a breakdown by age. And so I know as educators, you are probably most interested both in pediatric cases as well as the ages of staff that you might work with in your facilities. So this is a great way to understand what is going on in the community as a whole, and as well as the more severe outcomes of those diseases and who specifically is being impacted by them. Next slide, please. We already touched upon syndromic surveillance data, which was shown in the first tab. Going forward, we will be showing year-over-year comparisons for each of the 3 pathogens that we study, which will allow people to understand how this season might be the same or similar to what was experienced in the past, which is a really intuitive way to compare these data and sort of how high the burden is and the timing of those peaks. And then, as I mentioned, we have our wastewater surveillance, which is one of our newest tools. And so this currently is showing our COVID-19 wastewater concentration, which is literally a measure of how much viral material is being found in the sewage that we're testing statewide. And we compare this to our hospitalizations, and you can see that they do correlate quite closely. So this is a great not only indicator of what's going on in the community, but can also have some use as an early warning system to understand when we might see peaks in hospitalizations. As I mentioned, we have started also doing wastewater testing for influenza A, influenza B, and RSV, and we're hoping to add those tabs in the near future for this season so that, again, these data will be available for all 3 of those sources. The other thing I just want to briefly mention is that although you cannot see it at this time, there is also going to be an immunization tab. That's something that we've had in past seasons, but we turn off for the summer. So in the near future, that tab will go live again, and again, we'll show individuals who have been vaccinated for influenza as well as COVID-19 broken down by age, and then we'll focus on both maternal vaccine as well as nirsevimab administration to protect babies from RSV. So again, for flu and COVID-19, those can give great information about what vaccine uptake looks like in the age groups that are most important to you and your school communities. Next
Kristen,
slide,
if I
please.
could just
Oh, sure.
say something before we go forward. As I look at these slides, I just want to make the connection with attendance and that our chronic absence data, if you look at it over a year, we also had that high spike in February. You'll remember that was a really tough month, guys, for our attendance people for attendance. And you can see right here that this is one of the reasons why we struggle in February.
And I remember the second week after the winter break last year, I have a 4th grader, and my daughter came home and she was like, "Guess what, Mom? I am the only person who has not been out sick since we've been back." And I was like, "You are proud of that, but I am worried of what is to come and what this means for our family." So again, we're definitely supportive of kids being in school, but again, don't want them to be in school when they're sick and want to try to do whatever we can to keep the schools healthy. Next slide, please. In addition to our surveillance testing, we do work closely with our state public health laboratory. Most of this information probably would not be directly applicable to schools, but we do want to point out that working with local clinical partners, we can offer additional testing services and do additional surveillance testing to understand what's going on in the community, as well as to provide diagnostic services during outbreaks in partnership with those clinicians. Next slide, please. And then next slide again. And one more. So this image should look familiar from last year. It is the core recommendations both to prevent and manage illness. And these are applicable to both the general community as well as to school settings. And the good news is we've learned a lot. We've had a long history of following up on influenza. We've learned a lot since we first started working in the pandemic. And so we have a lot of tools in our toolkits that really work for all three of these conditions, as well as other respiratory conditions that we tend to see in the winter months that might not be one of the big three we typically focus on. So those core strategies are making sure that individuals who are recommended to get immunization stay up to date. In Connecticut, COVID and flu immunizations are available for all children 6 months and older. So that's something that's really strongly recommended for everybody to help prevent the spread and severe outcomes for those diseases. Really stepping up hygiene, especially at times of year. I know that people can get a little bit worn down with this messaging over and over again, but really trying to emphasize it at the times of the year when it matters the most. Doing what can be done to improve ventilation, whether that's spending more time outside or with open windows or some more creative solutions during the winter months as it gets colder. And then most importantly is staying home and preventing the spread. So, and then again, helping people make sure that they're getting appropriate diagnosis and treatment if they do become sick. So if somebody is sick with a fever, we do not want them in schools. We do not want them out in the community in general. If somebody is febrile, they should be staying home and away from others for at least 24 hours until their symptoms are better. And they're also fever-free without taking a fever-reducing medicine such as Tylenol or ibuprofen. Once a person is allowed to sort of go back out into the community, we do recommend that they take additional precautions for the next 5 days, such as wearing a mask to further stop the spread of these illnesses. And then other prevention strategies, such as encouraging masks if people have symptoms, improving distancing at times when you know there's a lot of transmission, and testing can also be valuable tools. And we know that some of these strategies are more challenging than others, especially in a school setting. And that's why there's really a layered approach to allow each school to really lean into those measures that work for them and that they're able to capitalize on, understanding that all of these might not be possible all of the time. Next slide. So winter is coming is my warning to all of you. Here in Connecticut, we don't have a crystal ball. We get asked that every year, but we do typically start to see our uptick in respiratory illness approximately 2 weeks after the Thanksgiving holidays and then continuing through the winter months. This year, the official predictions are that there will be moderate levels of respiratory illness. Last year, we did have what was considered to be a severe influenza season, so we're hoping that this year will be a little bit better. But even a moderate level can still be a lot of respiratory disease activity and something that needs to be taken seriously. And this is especially true when there are multiple diseases that are circulating at the same time, and we're not worried about the burden of just a single illness, but really the combined impact of all of those illnesses at the same time. One of the things that I'm really grateful for as a parent and also an employee of DPH, is the partnership that we've had with school nurses and other school staff in helping to amplify the messages about keeping kids home when they're sick, school illness policies, and other mitigation strategies via messaging home to parents. Typically, when I get off of these calls, I go back and I check my Parent Square app, and I have a message already from the school nurse saying, winter illnesses are coming. Make sure to keep your kids home when you're sick. So I know for us, this is common sense, something we think about a lot. But for parents, sort of giving them that reminder, especially at times when we expect increases in these respiratory illnesses, is a really important tool to get everybody on the same page and try to keep students home. Next slide, please. I'm happy to take any questions that people have. Honestly, I hadn't been monitoring the chat while I was talking, but did just see one pop up about how long a student would need to stay out after they test positive for COVID. In the olden days of COVID-19, there were different recommendations for COVID and other respiratory illnesses, which was very confusing and hard to manage. The good news is that for COVID, for flu, for RSV, for respiratory illnesses of unknown origin, the recommendations would all be the same now. And that would be that they're able to return to school when they are fever-free for at least 24 hours without the use of fever-reducing medicines, and that they're having a general improvement of their symptoms and feeling well enough to be in school. So instead of having a different strategy for every disease, which is really hard to manage, it is one strategy for all of these respiratory conditions.
Thank you for that question, Jeannie, and thank you, Kristen, so much. I'm just looking at the chat to see if there are any other questions coming through. And you can also keep adding even as we move along to Chloe and Kristen Kondash's presentation. We're happy to keep that dialogue going in the chat. And thank you so much, Kristen, for providing your contact information as well. I know that's a helpful resource for folks who may have things that are more complex they want to dialogue about with you one-on-one. I do see one other question coming up from Paula, expecting a large amount of absences in January because of the longer than usual winter break. So perhaps more travel leading to more illness. That seems like an educated guess. Kristen, is there anything you want to note about that? Or Kari, I see your hand.
I just wanted to note that this is a topic that should be addressed by school and district attendance teams when you're doing your school calendar, and also right now when you're planning for that January, to make sure you have activities and engagement for that kids want to come to school and that they don't want to miss. And so if they're feeling well, they'll come to school. If they're too sick for school, they should stay home.
Yeah,
Thank
and
you.
I mean, anytime that people are traveling or spending time indoors with people that they might not normally see, or people are really motivated to get together for the holidays and don't care if they're sick and staying home when they're sick, I mean, there are opportunities for increased transmission. So again, we would just encourage maybe before break to send out a message reminding people of the best way to prevent these diseases, and then hope that it's something that can help them make decisions about how to spend their break and prevent spreading illness to others, both when they return back to school as well as within their families while they're home enjoying that break time.
Thank you, Kristen. We have one last question in the chat, which is asking if DPH has a specific definition of fever.
I believe that now it is 101, but that is something I can confirm and put in the chat. I know during COVID it was a little bit lower, but I believe that it's now 101 as the baseline, but I will double check that and get back to you momentarily after the other presenters have shared their information.
Perfect. Thank you so much. And I really appreciate the sort of streamlining of the guidance around when parents know to send students back depending on the disease, because I agree completely. And I think everyone on the call probably does. That was really challenging for administrators and teachers and families to manage the different guidelines. So thank you so much for that streamlined approach. Hopefully that will help with messaging around when kids can come back to school. So let's go to our next slide, and thank you so much, Kristen. I'd love to introduce to you all next Chloe Ann Bobrowski. She is joining us from CSDE. Chloe has been working in this field for many years. She's a highly skilled and passionate nursing professional with extensive experience in school health and student services. Chloe has a Master of Science in Nursing in Community and Public Health from the University of Hartford. She also has a Bachelor of Science in Nursing from Arkansas State University. And Chloe has really built her career centered around improving student well-being across Connecticut. And currently she's the education manager for school nursing and family support services at CSDE. So we're so happy to have you here today, Chloe, and we can't wait to hear all of the expertise you have to share. And I'd love to also introduce your co-presenter. If we can go to the next slide. Kristen Kondash is joining us from Learn, and she is a nurse supervisor, a co-facilitator of the School Nurse Communities of Practice. And Kristen has been a nurse for over 20 years, 23 years, I think to be exact, and 14 of those years have been as a school nurse and the school nurse supervisor. So thank you both so much for joining and for sharing your expertise with our attendees today. And Ian and Sharon, if we can go to the next slide and kick it off.
Well, hi, good morning, everyone. It's really nice to be here. Thanks for having me today on this Talk Tuesday. I really appreciate DPH's presentation. Thank you, Kristen. Thank you, Dr. Sosa, for being here today and providing us with this really important information. And I also want to welcome a number of school nurses whose names I recognize as in attendance today. I'm happy that they were able to also see your presentation, looking at the dashboards and some recommendations that were really helpful. And so I am pleased today to discuss our portion of Talk Tuesday, Wellness Wins, Keeping Students Healthy and in Schools. So you can go to the next slide, please. I just want to read something from Attendance Works All In for Attendance paper. More than 1 in 4 children in the United States are chronically absent, defined as missing 10% or more of their school days, putting their long-term learning, health, development, and economic prospects at risk. Chronic absence affects all students with significant disparities by geography, race, and socioeconomic status. Absences due to mental or physical health challenges are one of the most common contributors. Many of the root causes of chronic absence, including limited access to health care, housing instability, and family stress, arise from the broader social drivers of health and originate outside of the school setting. But it is common, however, to consider chronic absence as solely an educational issue. Attendance Works' latest paper, All In for Attendance, provides strategies that involve stakeholders from the communities and health professionals to work collaboratively with school districts to address chronic absenteeism. So moving forward, the focus and the points made in this presentation really focuses on the collaborative role of your school nurses and health professionals, such as your medical advisors and APRNs in your school-based health centers, to improve student attendance, health, and family support. So next slide. So a study conducted by O'Donnell, which is the group that produced the campaign for Better With You in 2023, revealed that illness was the #1 reason that students were absent from school. And currently, the LEAP home visit logs also show that health and illness is the most common reason that kids miss school. So from this survey, we had a total of 5,488 respondents. 4,990 came from were responded to in English, and 498 were responded to in Spanish. We can see that illness was the #1 reason for keeping kids home from school. Within that category of illness, the 3 top reasons were fever and vomiting and doctor or medical appointments. So although we feel like there's not much sometimes we can do about illness or vomiting except for symptom management, there may be an opportunity for looking at medical appointments, encouraging families perhaps to um, keep the appointments, but allow the kids to return to school that day to finish their day, or perhaps scheduling an appointment that might be a little later in the day so they at least get a half day in to count for that day. That might be a small, area for being able to guide families for appointments so that students can actually attend school that day. Next slide, please. Health professionals' input can assist with providing the necessary guidance on health and safety and social emotional factors that may affect students' attendance. We also know that the medical professionals and nurses in your schools can help families with required forms for medication administration, or assist them for completing instructions on how to obtain forms, or provide contact information so that families have access to healthcare providers. And just a little tidbit for just your own knowledge is that school nurses also have vision certificates. So if students need glasses, they may have a certificate for free eye exam or a free pair of glasses. If your schools do not participate in the Vision to Learn, that might be another area where we may be able to assist the students so that they can have glasses as well to read. Next slide. We know that there are examples of students who complain to their parents that they're not feeling well, and the parent is on the fence, really, or feels that they may need extra support to encourage their students to go to school that day. So if we can have families bring their child to school and have the school nurse assess the student's condition to see if they are fit to stay in school, they may be able to assist the family in making that determination, and be able to have the students stay in school that day. And it also may give the nurse a heads up to have, treat that student with, more, carefully during the day, just kind of handle with care. And then we know that students with chronic illnesses, such as asthma or diabetes, they require daily interventions from the school nurse. But understanding the student's challenges that day and placing them on the wellness spectrum, it may decrease the amount of days that the student has, that the student misses due to their illness. And school nurses and may be able to assist the families, making sure they do have, if they have asthma, they have an action plan in place. Is there an inhaler at school? If they're not feeling well and they're on a sick plan, how the nurse can really assist with, delivering more interventions during the day so that student can come to school that day, even while they're on their sick plan. Next slide. We know the importance of a school nurse and a parent relationship. School nurses often have established relationships with families, maybe unknown to other school staff, which can be instrumental in improving communication and encouraging attendance. I know that in one of the schools that I worked with, there was an informal study, and there was students who were at risk, and members of the school staff were asked to just, do you know this student? Do you know this student? And oftentimes the school nurse may know the student before a social worker or a school psychologist. They may not be on their radar, but oftentimes school would visit a school nurse for a soft place to land if they're having, some small amount of anxiety. And so the nurse gets to know that student. And so that's just, be aware that there may be more relationships, and the school nurse could really be a valuable source of information if you're looking at students who are at higher risk. And of course, nurses can connect with families with resources. Again, they may have knowledge of, the community health centers, the local health departments, how to register and be part of the school-based health centers in the districts. So it could be very helpful for her to understand and acknowledge the valuable role that a school nurse has with your students. The next slide. Another thing is that medical documentation can be obtained by the school nurse for excused absences, especially when it becomes a little bit more challenging for absences 10 and above, where a student illness, in order for a student illness to be deemed excused, you need an appropriately licensed medical professional to verify student absences regardless of the absence length. So we know that your school nurse is a medical professional. So if the family, it may cut down on the number of visits that a family may have to go see a doctor in order to get a note that the student was indeed sick. The family could speak with the school nurse, and the school nurse, with her, critical thinking skills, can verify if that student is indeed absent. So this can cut down on time to the doctor. It cuts down on, payment to the doctor. It can be very, very helpful to have that nurse be able to verify that absence. Another good thing is the next slide. I wanted to show you all, in case you didn't know, that on the first page of the blue form, it's on the very bottom. The first page is really for the parent to complete. It's like completing just a physical history, medical history. And on the bottom, there's a signature line that allows permission for the release and exchange of information between the school nurse and the healthcare provider for confidential use in meeting the child's health care and educational needs. This signature is good for 1 year after the date of that signature. So oftentimes, first page doesn't come to school signed, but we hope to get those signed, and sometimes the nurse will kick back the page one in order to get this signed, so that this is a very valuable signature if we need it. So just in case you didn't know that. So the next slide, please. Again, we want to make sure that the nurses are aware of the McKinney-Vento Act. Many of you administrators who are on the call today, you may realize that many nurses that come to schools to work are usually from agencies such as hospitals, public health departments, or even visiting nurses associations. They may not be aware of the McKinney-Vento Act when they first start to work in schools. They usually have this legislation reviewed with them during their school nurse orientation, but it should be confirmed that they are that they've had the training, so that they know that students who are eligible to receive the entitlements from the McKinney-Vento Act, and they understand why. Also, like who the McKinney-Vento liaison is in your district. It'd be really good to make sure that those two are connected. Next slide. I've provided many resources for the nurses with this presentation, but school nurses have a dedicated access with read-only privileges to the DPH's department's CTWiz that allows them to look at immunization records for students. Also, there's resources that I provided at the end for information on immunizations for students who arrive to the United States as refugees, so that the nurses can assist to obtain students' health records and immunizations. And then finally, the next slide, please. And nurses can also help families establish medical homes in order to establish long-term health management. Many students who arrive from out of our country, the other countries, of course, appreciate and provide immunizations, but assisting families to establish a medical home for routine and preventative care may be new to them. So in order for, it's very important that they establish a medical home once they have are living in your community for the long-term outcome that this can improve overall health outcomes and prevent missed days of school due to preventable illnesses. Next slide. So again, we just kind of want to review and emphasize some of the information that our colleagues at DPH has already given to us this morning. Real strategies to stop the spread of any kind of viral transmission. We encourage schools to initiate some vaccination campaigns, again, using a parent square to share information to parents about local health department flu clinics, collaboration with your school-based health centers, and also collaborating with your community-based partners. Maybe you can bring a mobile clinic so that families to a family event where families can access healthcare. Just maybe, some ideas about that. And we also encourage staff immunizations so that you all stay up to date on, the relevant vaccines that are available for a healthier school environment. And next slide. I don't know if you all are aware or not, but Connecticut is part of the Northeast Public Health Collaborative with Maine, Massachusetts, New Jersey, New York, Pennsylvania, and Rhode Island. We know that there are some recommendations from our federal government, but this collaborative has joined together as more of a regional collaborative because we know that viruses don't have borders. And so in Connecticut, our recommendations for vaccines, next slide, please. Our Commissioner of Public Health recommends that anyone 6 months or older can receive the flu vaccine. Anyone 6 months or older can receive the COVID booster. I wanted to let you all know, in case you don't, that there is a new FluMist home that's been approved, that's FDA approved for privately insured individuals 19 and older. So this means that you can go online and order a FluMist, which is, the aerosolized, it's not a shot, that you can take it home. Children aged 2 to 18 are not eligible for the FluMist home administration. However, they can receive FluMist from their authorized providers of the Connecticut vaccine program. And also, I want you all to, take into consideration, I think Kristen kind of touched on it a little bit about treatment. If you have symptoms, these antivirals can manage your symptoms. Tamiflu and Xofluza are 2 different antivirals that are prescribed by your physician, usually within 48 hours of onset of symptoms. Tamiflu is usually given you usually take it twice a day. And Xofluza is a 1-dose pill for if you're prescribed that. It's just 1 dose. Now, these medications can also be used as prophylaxis, so that if you're living with someone that has been exposed to you while you have a flu, you can also talk with your provider, and they could prescribe these as prophylaxis for other family members, older, if you have older family members that you don't want to risk transmission, you can prophylactically have them start taking Tamiflu or Xofluza upon the recommendation of your doctor. All right, next slide. And again, to review the other mitigating strategies that DPH, Kristen had talked about, promoting really good hand washing, especially this time of year, making sure you've got your hand sanitizer available, a respiratory etiquette, of course, improving air quality, opening windows, getting outside when it's nice, cleaning your areas, disinfecting high touch points in the schools is also very important.
So if we could just take a minute, it's almost 11, and I wanted to just acknowledge a question that I think in the chat that I think folks might think is important, and that anywhere families can obtain free COVID tests.
That is a great question, but, and we used to be able to get those even via the post office, but unfortunately, there are no free tests available any longer. You can't order them. There's no free testing.
Okay.
Any,
Can you go to your doctor's office or the school-based health clinic for a test if you need to?
yes, you can
So
go.
insurance will
I mean,
cover it.
I was tested a few weeks ago. I went to the Minute Clinic at CVS, but you can get tested at Minute Clinics. You can go to your doctor's office. They can still do the tests.
Okay.
Yeah.
All right.
I think that might be my last slide. Let me see what the next one. Yep. I am going to hand it over to Kristen Kondash. Hi, Kristen.
Hi, thank you so much, Chloanne. And I know that we're at the end of our time, so I'm going to do this real quick plug, and I hope that you guys can all take a look at the last few slides that are on here. I know people have had access to this. When is sick too sick for school? This slide and one more, if you can move forward. The National Association of School Nurses has also put one out with some different information. These are great. I sent these out often, even though it's the same thing that people get. Parents put them to the side and sometimes don't ever look at them again. So I do send them out probably monthly through this time of illness year. But I do recommend that anybody who's using these, please look at them and adapt them to whatever your school policies are for exclusion. They are a little different, and we want to make sure that we're giving parents the correct information for your district policies. If we can go to the next slide, the very last one here, this is just some feedback as myself as a school nurse and a nurse supervisor, and things that we hear from other school nurses during our communities of practice of why it's important that a school nurse is on your attendance teams. We should be part of your attendance teams. We do have valuable information that you guys might not have, and reasons why students are not accessing school. As we saw, illness is the number one reason that kids are being kept home, and us as school nurses are the first line of defense for student health. In some districts, school nurses are part of that team, and in others, they're not. Sometimes it's because the nurse can't get away from their office, or that they're just not invited. So a couple ways to maybe accommodate having your nurse at least give some feedback to these meetings, or, notify them when you're having them. They usually happen on a regular basis so that they can prepare some data for you. If the nurse can't be present there, then maybe they can review the students that you're taking a peek at and give you any information during that, before the meeting, or you can call them during the meeting to ask for some information. But sometimes vice versa, us nurses attending these meetings find out about kids who are not attending school that we don't know about, and that might have some chronic conditions that we can assist the family with. A lot of families don't know that we can implement sick plans or orders from doctors when they are discharged, either from the hospital, in ER, or from their own family practitioner. And they don't realize that we can do those things at school. And sometimes those things don't exclude kids from school. So that communication and that, rapport that school nurses often have with families is really important. My last part of this, I saw that there were lots of social workers on this meeting. It's just as important for you to collaborate with your school nurses, because often, mental health is your lane, but it crosses over into the medical health. And we often have information regarding that you might not have, and vice versa. So definitely, I find my social workers are my best friends, and we talk about students often to be able to keep them in school. So thank you so much. I'm so sorry it was so rushed, but I want you guys to all be able to continue on with your day, as we all have really busy schedules.
Thank you so much, Kristen. I love ending on this note that our school nurses and our school social workers are such critical partners as we work on attendance within our buildings, and should be absolutely members of our attendance team. So thank you for sharing that perspective. It is so crucial. Let's go to our last slide, and we just want to remind everyone, next time we'll be together is October 21st. We have a discussion on tap with experts from the Department of Children and Families. So we hope you will join us for that. This recording will be made available, as well as the slide deck on our @Advanced site, and I know it's in the chat as well. Thank you so much to Kristen, Chloanne, Kari, everybody for presenting. We appreciate all the information, and we appreciate everybody attending today. I hope you have a wonderful rest of your Tuesday and stay healthy out there. Thank you all. Take care.
Thank you.